Okay, this one is titled Service Providers Need to Plan for Future Low Chance, High Impact Events. Here's what this study suggests is important. The COVID-19 pandemic was a significant global event, and one that could be described as a low chance event with high impact. So unlikely to occur, but with a high impact if and when it does. There may be future low chance, high impact events. This could be another virus pandemic or something else. It's important that organisations are prepared for such events, and this study suggests that there are a number of things that need to be considered. The first of these is about the need for the organisation to be flexible and able to adapt and change as the circumstances change. As we remember from the start of the COVID-19 pandemic, the situation developed rapidly. It was important that drug and alcohol services were able to adapt quickly. The next point is the need to work with multiple partners in order to effectively maintain service delivery. Our analysis suggests that it's unlikely that a single large service provider will be able to maintain effective service delivery on their own. Working closely with smaller partner organisations, such as those who work with individuals from specific priority groups, is likely to be essential to reaching those most in need. Strong relationships and working between different partners and organisations was important in maintaining effective services. And there's even evidence that partnership and joint working was more effective during the pandemic than before. The fact that these strong relationships and ways of working together existed before the pandemic aided modifying and effectively delivering services during the pandemic. Another factor that helped services to respond to the challenges of the pandemic was that those with the most relevant knowledge and expertise were included in the planning and the decision-making around modifying services. So it wasn't a case of decisions being made by senior managers only. Frontline staff and staff at different levels of the lead organisation were involved in planning and decisions. This wider involvement from different levels of the lead organisation helped to ensure that the full range of staff expertise fed into decisions. The next point is a general one, but one that was very, very important. Being open as an organisation to new ideas and new ways of doing things. In terms of drug and alcohol services, staff often mentioned that to deliver services during the pandemic, they needed to consider delivering in a way that they might previously have thought was impossible. And in many cases, they were surprised by how effective these new ways of working and delivering were. For example, reducing daily pickups of opiate substitution medication for certain service users, or supporting some service users primarily remotely for the whole of their treatment journey. When the pandemic occurred, the disruption to the service meant it wasn't possible to maintain the same level and extent of services for all service users. The lead organisation needed to prioritise certain service users, those who were most in need or assessed as particularly vulnerable. This really highlighted the benefits of having good quality assessment, service and client data on which to base decisions and modify services. Another important factor in the maintenance of effective drug and alcohol services during the pandemic was the leadership and guidance provided by organisations and managers. This helped staff and service users manage the upheaval caused to the service. Even though there are times when things were uncertain, the leadership and guidance provided by the organisation and managers, for example through issuing guidance and protocols for managing the changing situation, helped staff and service users feel that things were on the whole managed and under control rather than things feeling chaotic. Like most organisations, those delivering drug and alcohol services were largely caught unawares by the pandemic. It quickly caused disruption to services, and most service providers and people were unprepared. Forward planning would have helped greatly. It may be the case that scenario planning for future low-chance, high-impact events of various types is needed to make sure that services are able to cope with such events in the future. Similarly, to prepare for future disruption to services, service providers need to assess what resources and infrastructure might be needed to maintain services, especially services for the most vulnerable service users, if different low-chance, high-impact events occur.